All right, in this video, we're going to talk about dry needling. It's super awesome. It's one of the modalities that we use here at Reborn. And we get questions all the time. What is dry needling? How does it work? Why do I need it? All those things like that. So we're going to go over that. So most people think, oh, it's like acupuncture. Not really. So we have acupuncture, which is like Eastern medicine, chi energy, meridian lines. And then we have dry needling, which is going into the trigger points or knots and creating a twitch in your muscles. So those are the differences. The similarity is it's the same needle. So that's pretty cool. So what we do with a dry needle and why we do it is if there is trigger points or knots that are causing restrictions, pain, discomfort, in decreased mobility places. And it's an amazing tool that we have. So what happens physiologically is normally your muscles slide and glide like this. But when they get bound down or tight and don't move and slide and glide and they create a trigger point or knot, then we use dry needling to help release that. And so why does a trigger point or knot happen? Good question. It's because there's been a threat to your nervous system, meaning fall, birth, repetitive overuse, things like that, and the list goes on. And so it doesn't really matter how it got there, but we know that we can get rid of it, and we want to change patterns of like if there was a repetitive thing that happened to give that tissue better movement there. So we take that needle, we stick it in to the muscle belly, and it creates a local twitch response. So when things aren't moving and sliding and gliding, what happens physiologically is there's decreased blood flow, decreased oxygen, pH drops, and all these neuropeptide chemicals sit there and signal to your brain, ow, pain, sharp, dull, stabbing, throbbing, stiffness, tightness, whatever your brain's perception of that is. And everyone's body and brain has different perceptions of pain, and pain is very complex. So we're gonna leave it at that for that piece. So we take a needle into the trigger point and it goes like that. It's a reflex. So you have no control, similar to the reflex on your knee when you take a reflex hammer to it at the doctor. You don't have control of that. It just goes. So when it goes like this, it kind of feels like your eyelid twitching with some spicy, sparkly electricity, although we don't have any electricity hooked up. It's kind of similar to rock pop candy. So, you know, like when you were a kid and you ate rock pops and it's like in your mouth, feels like that. And then also similarly feels like when you're walking into a haunted house and you know something's going to jump out at you, just don't know when. Also that. So it's a little bit of a startle because you're like, okay, it's coming and where is it? Ah, there it is. And so when it goes like that, immediately blood flow comes back in, oxygen comes back in, the pH gets restored, all those neuropeptide chemicals release, the muscle has better activation, better slide and glide, better mobility, less pain, perception of all those things immediately, which is super, super cool. The other important piece to remember with dry needling is that you might have some dry needling soreness afterwards. So what we mean by that is it's similar to a workout sore, can last anywhere from a couple hours up to 2 days. And that's completely normal because what's happening is you're having a maximal muscle contraction right where that needle was. And so you're going to feel sore, and all that lactic acid and peptides and chemicals that are releasing leave a soreness there, but that all flushes out. So we often encourage people to move around, stretch, walk, go for a walk, do a little yoga, drink lots of water, flush it out. Honestly, the worst thing you could do is sit on the couch and not do anything. You'll probably be more sore. So that's what dry needling is. We love it from a clinical standpoint because it's a game changer. What we can do with dry needling in one session would usually take 8 or so sessions of just like hands-on manual therapy with other techniques. So if it's an appropriate tool for you, we highly encourage you to try it, recommend it, see how much you can tolerate, and it just speeds up your recovery and your rehab process. Now, is needling for everyone? No, there's definitely some contraindications for some people, and we'll make sure that it's appropriate for you when you come here. But all of our patients love it. So from a clinical side, like I said, game changer for us because we can get so much more done so much faster, and it gets real results real fast. From a patient perspective, it's life-changing. It's usually the missing piece for a lot of people to get the results that they're looking for because it's a direct interface with the nervous system, meaning that we can literally go in with that needle and communicate with your nervous system to change everything both locally in the spinal cord and up in the brain, just with hitting a needle on a trigger point. Really, really cool. And so all of our patients love it most of the time. And that's why we get people who are leaving Google reviews for us of like, this was life-changing. I love dry needling. It's so great, like all of those things like that. So we hope that you're excited to come in, see us for dry needling, and see what it's all about and experience the magic for yourself, because it's really, really awesome and can really change your life.